Hello, and welcome to the Synaptic Advisors demonstration of our solution to help payers manage the chronic conditions of their member population. I am Paul Peterson. Before we get started, I would like to share some background about why we developed this solution. Some of the most alarming statistics around healthcare spending are related to chronic conditions. 83% of total U.S. healthcare spending is on chronic conditions, and almost all of Medicare spending, 99%, is for members with at least one chronic condition. A key component of managing these chronic conditions is the health risk assessment completing during the member's annual wellness visit. HRAs are essential to identify health status and needs to ensure members are receiving the proper care. Payers utilize the information collected in an HRA to provide members with personalized member-centered cares. The chronic conditions are better managed by identifying critical gaps in care, providing appropriate clinical treatment, and creates a better understanding of the health of the overall member population. Synaptic Advisors HRA solution provides payers with a powerful set of tools that are used to better manage the care of their member population. Built on Salesforce's Health Cloud and Field Service platform, along with Eureka's mobile health application, the Synaptic Advisors HRA solution pre-populates the assessment with information needed by the clinicians to complete the assessment. This information includes demographic information, enrollment information, and even gaps in care information. It is a simple-to-use application that guides them through the assessment process, making sure all information is captured and all assessment requirements are completed. Assessment information captured during the assessment can be used by the payer team to create a plan for managing the health of the member. And it can also be used in both an online and offline capacity so the clinician can operate in any environment. The Synaptic Advisors HRA solution helps payers improve the overall health and wellness of their member population while reducing healthcare costs. So let's begin. The solution you are about to see will demonstrate three key processes: scheduling an assessor, a nurse practitioner in our demonstration for an in-home visit, conducting the assessment, and utilizing the information captured by the HRA to illustrate the power of the solution to improve the health of the member population. We are going to focus on four key personas in our demonstration: a care manager who manages the workload of the field assessors, a care coordinator who schedules the in-home assessments, a nurse practitioner who will be conducting the in-home visit, and of course, the member receiving the annual wellness visit. Our process begins with the care coordinator, the person responsible for scheduling the nurse practitioners for in-home visits. Our automated workflow has searched our member information and has determined that Oscar Hernandez Donald Sutherland are due for their annual wellness visits. The screen in front of you is a view of all the nurse practitioners and the schedule for this week. The coordinator will be working with Oscar first, so she calls him to find a time that is convenient for him. Oscar tells our coordinator that he is available through the rest of the week, Wednesday through Friday, January 11th through January 13th. The coordinator enters this information, and now it's time to go search for nurse practitioners that are candidates to be able to meet this time frame. The criteria for searching for a nurse practitioner not only includes their available times, but other criteria such as territory, language, time with the payer, experience as a nurse practitioner, and other criteria. Our member information includes Oscar's preference to conduct the wellness check in Spanish, and he lives in Franklin, Tennessee, which is in the territory of Williamson County. Our search finds the nurse practitioner, Charles Darwin, and the best times for Charles. Our care coordinator selects a time for Thursday, January 12th at 10:30 a.m. and reconfirms with Oscar. The appointment is now set, as you can see on the calendar, and the nurse practitioner is ready to conduct the wellness check. Each day, the nurse practitioner accesses the mobile part of our solution to determine their appointments. Charles will be using his mobile phone to conduct the assessment. This assessment can be conducted using a variety of mobile phones and tablets. Charles sees that he has an appointment with Oscar Hernandez and travels to his home. Charles is now ready to begin the annual wellness check with a health risk assessment. The health risk assessment is pre-populated with the most up-to-date information about Oscar. The assessment is divided into multiple sections that reflect the different types of questions and information to be gathered during the assessment. This HRA is aligned with CMS guidance on the type of information required in the HRA and includes additional information such as social determinants of health. Let's begin looking at the assessment information itself. As mentioned earlier, I am on a mobile phone, and it's very easy to simply scroll down through the different sections. We have biometric data. Some of this data is not only populated with information about Charles, but we can update it based on the assessment information. We've got general health information, and we've made this as simple as possible for the assessors. The user interface is very simple to use, and it's simply just a matter of tapping each one of the answers to the particular questions. We've tried as hard as possible to eliminate all keystrokes and simply selecting each one of these radio buttons when an answer is given by Oscar. As we continue to scroll through this, we've got tobacco and alcohol use, nutrition information, and also physical activity. As mentioned earlier, the assessment is pre-populated with information known about Oscar. We looked at Oscar's claims data and determined that he was taking 4 different medications, and we've gone ahead and pre-populated these medications in the assessment itself. Now, Oscar may have just begun taking medications and has not submitted any claims for them, so we can simply add a new medication based on information gathered from Oscar. Our next section is where we highlight any gaps in the care that Oscar is receiving. Based on analysis of existing medical information, the solution highlights the gaps in Oscar's care. This is important to review with Oscar during the assessment. For example, because of Oscar's age, it is important that he regularly gets his flu shots. Also, because of his age, it is very important that he get a colonoscopy every 10 years. And Charles hasn't had one since 2010. Payers offer many types of care plans for their members. Fall prevention is one example. Many people in Oscar's age group are at risk for falling, and payers want to help prevent that from happening. Our solution will analyze Oscar's answers to the question in this section and determine if he will be eligible for the fall prevention care plan. If he is, a care plan will be automatically created and available to the care manager to begin working with Oscar to help keep him from falling. This is one of the most powerful features of our solution, our ability to take answers given to specific questions and create intelligent actions from that information, such as automatically creating a care plan. Healthcare organizations today are focused on social determinants of health, so the HRA includes questions about such things as their living conditions and other conditions that provide insight into a member's living conditions. Another powerful feature of this solution is the ability to create insights from the answers to the questions and automatically create actionable information, such as recommending the proper ICD-10 codes related to social determinants of health. The HRA includes sections for gathering information about pain being experienced by Oscar, any depression issues he's struggling with, as well as social emotional support, advanced directives, and self and family history. The HRA also includes a list of providers currently seen by Oscar. Once all the information for the HRA is captured, the nurse practitioner will sign it, date it, and submit it for processing. The assessment becomes part of the 360-degree view created for the member. As you can see, we have captured information from every interaction we have had with Oscar, including the just completed HRA. Also, please notice that it was determined that Oscar is eligible for the fall prevention program, and a care plan was automatically created based on the answers Oscar gave to the nurse practitioner. This information is available to the appropriate payer team members, such as care managers assigned to Oscar, customer service personnel, and others within the organization that need to see information about Oscar Hernandez. The care manager can access that recently completed HRA and see all of the answers that Oscar submitted to the nurse practitioner. I'll draw your attention to the top of the screen, and there are 3 insights created from the answers that Oscar gave the nurse practitioner. One is he is indeed eligible for the fall prevention program, and you can see the care plan over on the left-hand side of the screen that represents that. We also took some of the answers and created 2 different ICD-10 codes. These are representative of social determinants of health, and this information can be easily forwarded to the coding team. As you can see, all of the information captured during the assessment is included in this view of the information. This concludes our presentation. Thank you for joining. For additional information, please email me at paul.peterson@synapticadvisors.com or call me at 615-838-3923. Thank you again for joining.